enjoy and look forward to hearing your presentation. Thank you, Kerry.
Good morning, everybody. I too would like to acknowledge the traditional owners of the land on which we're meeting today and pay my respects to their elders past and present, acknowledge other Aboriginal and Torres Strait Islander peoples here in the room, and to all of you, our fellow Australians, thank you so much for doing the work that you do in our communities. Apparently, there we go. I can't play this particular video, but I do want you to just pay attention to that link. It is a really extraordinary little film about a preschool that happens in an aged care home. And it is this really extraordinary way of being present to the process of ageing from a 3-year-old's perspective plus an 80-plus-year-old's perspective. And this notion of the fact that we are all deeply and profoundly connected, and that life, when you're faced with life, is just the most extraordinary thing. And part of that life necessarily involves the process of dying. And one of the old ladies in the home manages to pass away in this really extraordinary way of being able to be present to these young people who also are really engaged in the process of living. And so I just thought, through watching that video, about this concept of the first 1,000 days and the last 1,000 days, and how you might be able to bring both of those end of lives together in very powerful ways and have a different way of being able to think about living and dying. I'm not having much luck here. There we go. So what I want to do is just go through this presentation. There. It's really not happening for me. Point it towards the back of the room. No, it's just doing what it's liking to now. Well, here we go. Can someone just help me go back to the beginning, to the 3rd slide? That would be very helpful. Back one more and we'll see if we can go to it again. Okay, so what I'm going to do is just very quickly talk through in this presentation about this idea of the first and last 1,000 days. It is a lifetime approach to health and wellbeing and bringing those times together, as well as then this important period of time, which is from preconception through to age 2, and the kind of powerful impact that that then has over the course of someone's life. Can you just push the button? There we go. So I was chair of NATSIDAG, which is an unfortunate sounding acronym for the National Aboriginal and Torres Strait Islander Dementia Action Group. And it was very interesting because it was auspiced by Alzheimer's Australia, who at the time didn't believe that Aboriginal and Torres Strait Islander people got old enough to really think about dementia because we were all dying very early, and that there wasn't really an aged care kind of, there wasn't really necessarily an investment required in aged care in particular. And what I managed to do then was bring together 35 people and then develop up for them a really important strategy, and Dina's work was key to that at that period of time. Next. So what we did find was that a range of our peoples were ageing and had dementias at an earlier age. And I was, like most people, thought stereotypically that that had to do with the amount of alcohol that people were drinking. And it wasn't that at all. It was around vascular-related dementias, in which case then the public health intervention was an in utero one. And I thought, my goodness, what we have to do now is start to think about the process of ageing from in utero view. Next, thanks. So when we did think about this new public health approach, what we talked about was the importance of brain growth over the course of a person's life, and that those things are enormously powerful in the way that people age across the entire life course. And so in terms of that, what we were able to do was something pretty profound. Next. What we're doing now is working with mothers, parents, teachers and peers in this first 1,000 days process. And what we're looking is trying to reduce the experiences of adverse life stressors on the health and development of young people, so that we do have good health outcomes, good social outcomes, addressing some of those issues around educational disadvantage, so that we're setting kids up for the very best start in life, but also across their lives. Next. So in terms of this work, what we thought would also do is not just focus on the point from conception, but also understand the motivations about why people were becoming parents, and understand that kind of context, and then work with those parents across that pregnancy in particular to make sure that the brain growth was happening in the way that it should do. And what we found was that there are a whole range of early life stresses that do have an impact on a person's experience of ageing across their lives. And this also does play into a whole range of issues around why people choose to die and why they choose to die violently in some instances. So that notion of self-harm is something that happens because of the impacts of these early life stresses. But they also then predict the quality of ageing and the experience of ageing that people have. And so what we did was really think about how could we then support secure families to happen? How can we increase people's parenting skills? How can we utilise informal education processes to really facilitate good brain development and brain growth? And then what kind of things can we help people access in order to help promote good health and wellbeing across a person's life? And what we did do was understand the very powerful impacts then that these early life interventions have across an entire person's life. And so in terms of these longitudinal studies, many of them have been going for a number of years now, and in some cases a number of decades. And what they were able to show was that notion of being bonded to their children, that notion of being able to have good quality nutrition, that breastfeeding, all of those kinds of things have a really powerful impact on a person's quality of life across their lives. And so what we're trying to do is really optimise brain development in utero and through early childhood development. We're looking at a whole range of things, particularly in the responsive parenting space, in order to help facilitate this notion of self-efficacy and self-worth, a sense of social connectedness. Loneliness has a really big impact on a whole range of people at this point in their lives. And then also creating some health beliefs and healthy beliefs in a cultural context that really do set up people's sense of personal achievement and what their hopes and aspirations are, and then giving some way to be able to have an impact on those things over time. And what we found about the experiences of pregnancy is that there are a number of unwanted or mistimed pregnancies, and that really does set people up for the quality of the relationships that they have with their children. That there are a number of younger parents, and those parents are becoming younger across all of our different groups that make up Australia. But a number of those things are starting to have a big impact in terms of child removals. There's an increasing exposure to criminality during pregnancy. Used to be men just used to be drinking, and now there's a whole range more women coming into that experience. And also then just lack of access to correct information about health and wellbeing during pregnancy, and how do we actually make that meaningful for both men and women. Those are the kinds of challenges that we're up against. And when you think about what it means in a cultural context, we're not born into a society at all. We're born into ecosystems. We are born into country. And that the ways that we're being asked to participate in modern Australian society is actually creating for us opportunities to also be biocidal, which doesn't actually sit well within our care for country and everything in it, stewardships and custodianship ideas and qualities that we have. The other thing that we often hear is in the first sentence of every peer-reviewed paper is about how disadvantaged we are and how we're not making good contributions, and that we're so disadvantaged. In fact, all of our issues can only be solved by someone outside of our world and experiences. And so I make it a point to tell people that we're precious and extraordinary beyond words. Everything that I say and do is about that. The other thing is that we've got this whole expert industry, particularly in Indigenous affairs, that if we were able to achieve self-determination and citizenship, we would dismantle a multi-billion-dollar industry. And so there seems to be a whole range of economic drivers and impacts that sit behind this constant welfarisation of us and the rise of the expert, as opposed to really investing in families as universal service providers. And in terms of those things, they have a very profound impact on how we realise self-determination. So in terms of the first 1,000 days work, it is all now governed through a board, a council of elders who are quite extraordinary. And the things that we're looking at doing is looking at culturally informed parenting and connecting people with spiritual and physical worlds, as well as with our natural environments, and really giving the values that underpin the experiences of quality living and quality dying as well. So that notion of kinship and compassion, hospitality, reciprocity, justice, guardianship and solidarity, and including that holistic view of health, including the cycle of life, which necessarily is about death too. And part of their legacy platform in their inaugural statement is to live, to love, to learn, and to leave a legacy, which is all the qualities of a life well lived. Next. So in terms of this, what they have done is develop up a statement for us which talks about what it is that children could rightfully expect prior to their being conceived. And what they'll be expecting is to be born into families that seek preventative and early intervention, where parents have loving expectations of them and who help them achieve their life aspirations in powerful and tender ways. They also talk about the importance of participating in children's education from birth. Every child should rightfully expect the opportunity to develop a range of literacies cognizant of our culture and to engage them in processes of learning that ensure our collective professional capabilities align with our cultural values and responsibilities, and their own personal aspirations as well as our entrepreneurial spirit. Every child, before they're conceived, have a right to have expectations of their parents that they'll be born into families who know who they are, where they come from, who they're connected to, who loves them, who advocates for them, who listens to them, and who is responsible for them culturally, morally, physically, spiritually, and emotionally. They have a right to be part of a healthy and vibrant society. They have the right to have the same opportunities as other Australians without being made the same. They have a right to feel hopeful about their future and to imagine a future where they're respected and valued, and to participate in pathways that lead them to align their life's purpose and meaning with what it is that they do on a day-to-day basis. They have a right to be born into families who can transform those harmful experiences into one that allow them to live a positive life with a peaceful heart. They have a right to be born to parents who themselves are supported through strong kinship relationships, who are empowered, healthy in mind, body and spirit, capable of nurturing themselves and each other, and who have the resources and selflessness necessary to give their child the optimum start to life. In the first 1,000 days, our children have a right to be born to people who are responsible for their connections to our ancestral past and supported in their role to co-create a future for their children and grandchildren. They have a right to be held in a mother's womb that is pristine and nourishes them with good quality nutrition free from alcohol, smoke, and the experience of violence. They have a right to be born into families that have healed and have broken free from transgenerational trauma, and they also can rightfully expect to be born into families that have the capacity to celebrate them and offer them ceremonies, rituals, language, songs, stories and environments that strengthen their resilience and identity, encourage their growth, and for them then to have identities of their choosing. So if these things were made possible, then no child would end up in out-of-home care as a result of neglect or violence. No child would have an immediate trajectory into prison. No child would be cared for outside of the context of their extended family. And every child would then grow to have a good quality life and a lived experience that meant in their old age we were able to participate in that onward transition between this life and the next realm and be supported by those around us who love and care for us. That would be, for me, an extraordinary opportunity. But what we do have are people who are self-harming, successfully suiciding. They are being murdered, they are in accidents, they are diagnosed and immediately pass away because they haven't seen a health service provider early on. And all of these things deny us the opportunity to honour them and respect them on their way out. And I think that's a great travesty on part of our peoples. The first 1,000 days, families know that this period of time from preconception, conception to age 2 determines the health and wealth of the world. I will not be working in any other period of time in a person's life other than this period of time. It's what my 30 years have told me is the most critical part of a life for any person anywhere on the planet. And death is a normal part of that life. We have 7 billion people alive at the moment on the planet, which means that we're going to have 7 billion people die. Some of those will be in circumstances that they have control over, many will not. Those are the sorts of challenges that we're up against, and we need to challenge the status quo in how we do our business, because our normal isn't normal anymore. It's not working for us. The quality of our life and experiences across our life means that we're not able to enjoy, as a community, the totality of a palliative care experience. And we need some more champions who can really work with us in our communities and transition those knowledges across. So what it is, it's a people's movement, it's nations building. It is uncompromising standards to co-create the very first 1,000 days in our communities. It's really about what it means to be a full citizen, and we're trying to overcome and redress a whole lot of those systemic failures that have seen us transition into institutional care at a very young age. And what we really do need is a return to those values that underpinned our communities since time out of mind. Yes. And what we need is a continuum of success derived from with our own family experience. What we've got is a holistic health concept, which includes cycles of life, death and life, and really does position an individual person in the context of a whole of human experience, but also in a whole community experience. And what we do talk about is health, wellbeing and death needs to be constructed and able to be facilitated in racist-free healthcare systems that can truly place our culture at the centre of that. And that's going to be deeply challenging. Like I said, there are a whole range of reasons why I started to focus on this first 1,000 days. But basically, for me, there was an international nutrition intervention, and we've seen a whole range of other things start to come into play, and increasingly the number of young women in prison is a really important one for me, because what that means now is that both parents are in prison. And both parents in prison means that children get cared for in other than family contexts. We've also got an Aboriginal Children's Commissioner that really does talk about the powerful impact of violence in our communities. What we've also got are young people being thrust into parenthood without knowledge, skills or support. And those sorts of things need to be really taken and changed. The language that we use to describe adolescence as parents needs to be changed. We're not going to implement the Close the Gap by 2030 as service providers. We're just not. I'm sorry, I'd really love to be able to say we're going to do that, but we're not. We're not the people responsible for it. Parents are responsible for making their children have an equitable life experience, and our work has to be around supporting parents. So what we did was have 4 symposia with over 380 people from across 100 different organisations. And what we did was establish some goals for this first and last 1,000 days work. The first is to bring together this idea of the first 1,000 days and invest that across generations, and then also then use this period of time so that we can have good quality life and family enriched palliative care at the end of our lives. Yep. We've got a whole range of interventions here that we're measuring the impact of these things during the first 1,000 days, and hopefully get an understanding about what that means for good quality life and living, particularly as we all have, as Aboriginal and Torres Strait Islander people, a common heritage of loss. We've got higher death rates, we use health services less frequently, we've got a lot of unfinished business, and where we've got the opportunity to care for someone who's dying, then that triggers our own traumas. You can get a whole range of extended family networks involved in burial rituals, but those things may not be able to be accommodated in the palliative care services that we're part of. With death comes blame, and so there's a whole range of things that go on through that sorry business process that need to be accounted for. And what we really want is for people to be cared for on country, for people to be able to participate in those ceremonies. And what we do is really think about aged care, but what we haven't done very well in our communities is think about palliative care for younger people and for children. And I think that that's a real area that we need to be able to put some thought into, as well as pain management across a person's life. these are some of the things that we're doing through the Indigenous Health Equity Unit. We're developing curriculum, we're developing the capacity of our partners, we've got international collaborators, we're supporting the development and redistribution of cultural knowledge. And I think in this shared research agenda, what I'd love to be able to see is the first and last 1,000 days come together. This notion of health and wellbeing and quality of life across different generations, and then talking to young women in particular, or young families, about the fact that they're not giving birth to a baby, they are giving birth to a potential 80-year-old, and how your quality of pregnancy determines that, I think, is going to be very interesting. So if you can have a pristine pregnancy, that actually has an impact on palliative care, in that we get a chance to be able to experience it. And so these lifelong trajectories, quality of first 1,000 days determines in long ways the quality of your last 1,000 days. I think I'll leave it just there. Thank you very much.